Welcome, everyone. Today we'll be covering the management of endotracheal tube cuff pressures using a manometer to improve patient outcomes. We'll look at why it matters, how to do it correctly, and what happens when cuff pressure is out of the safe range.
The cuff on the endotracheal tube is what seals the airway to allow for effective ventilation. It prevents air from leaking out and helps prevent aspiration of secretions. However, the small balloon can cause big problems if the pressure is too high or too low. Today, we will cover these learning objectives. First, the importance of endotracheal tube cuff pressures being maintained in the safe range. Secondly, how to recognize complications from incorrect endotracheal cuff inflation. And thirdly, how to properly use a manometer for cuff pressure monitoring.
The primary function of the endotracheal tube cuff is to protect the airway, which means that it creates an effective seal in the trachea, ensuring a sufficient pressure to prevent both gas leaks and fluid aspiration, but while also being low enough to preserve tracheal perfusion. Typically, endotracheal tube cuffs should be inflated to a safe pressure range between 20 to 30 centimeters of water. However, improper management can lead to preventable patient harm. For example, overinflation of the cuff can result in excessive pressures that may cause complications such as injury to the tracheal mucosa, vocal cord dysfunction, and a sore throat, while underinflation can lead to aspiration and ventilator-acquired pneumonia.
The literature demonstrates that endotracheal tube cuff pressures using guesswork techniques such as palpation and air leak methods fall outside of the ideal pressure range 76 to 80% of the time. So a practice change is imperative in order to prevent harm to our patients. Luckily, the literature also demonstrates promising improvements with best practice change. A quality improvement initiative presented by the American Society of Anesthesiologists in July of 2023 demonstrated that placing manometers in all operating rooms, along with provider training, resulted in a 54% reduction in cuff overinflation and a 47% reduction in sore throats postoperatively. Currently, the practice at Bridgeport Hospital is mostly palpation technique. And as these studies have shown, this likely has us falling outside of safe pressure range.
As mentioned before, if the cuff is underinflated, we can run into several issues. First, we may hear a leak or notice the ventilator isn't working. Secondly, secretions from the mouth or stomach can be aspirated into the lungs, increasing the risk of pneumonia. And thirdly, the ventilator may alarm frequently due to low pressures. On the other hand, overinflating the cuff puts too much pressure on the tracheal wall. Minor complications can be a sore throat. However, it could also be major complications due to the reduced blood flow and tissue damage. Over time, this can lead to tracheal stenosis, tracheomalacia, or even a tracheoesophageal fistula. These complications are painful and often permanent.
A manometer is a device we use to measure the pressure inside the cuff. It connects directly to the pilot balloon of the endotracheal tube. After the manometer is attached to the pilot balloon, wait a few seconds and check the reading. If the pressure is too low or too high, adjust the cuff slowly and recheck. Once the pressure is within the safe range, document your findings. We should be checking cuff pressures when the patient is first intubated and then regularly throughout their care. It's also important to check after repositioning the tube or repositioning the patient. Here's a quick YouTube tutorial on how to properly use a manometer and where they are located in Bridgeport Hospital.
Okay, so we can come into the anesthesia workroom here. And on the right in this top cabinet, we have 3 manometers here for the main OR box. And this is the posy manometer. You can see obviously the red is bad, the green is good, and our range ideally is from 20 to 30. And that's in centimeters of water. So I have an ET tube here, and with this design, the handle itself is a bulb that you can use to inflate the balloon on the cuff. And you can hook the pilot balloon right to there. And then the red is how you release once you've inflated, too much or you want to deflate the cuff, you can release there. So one-handed. If I put this here, we'll see that as I squeeze, it goes up, and you want to inflate slowly. You can see that the balloon is inflating as I do this. All right, so here we're already above where we want to be. So then I can lightly touch this red and bring it down to be in range. Okay, so now we're in range. Obviously, if there were tracheal tissue pressing on this balloon, our pressures would read different, but for this scenario, this is how much air it takes for us to be nearly in range. And then I just want to show that the balloon really doesn't feel very inflated. Actually, it feels half deflated. So likely, we really don't need a full and stiff balloon in order to be getting accurate pressures. So for your cases, you can inflate your cuff using this, or you can bring it to your room and just measure the pressure that you have once you have inflated with a syringe, and then use the red side here to deflate to a safe range.
Okay, so as we can see, manometers take the guesswork out of balloon inflation and help to prevent complications. A few best practice tips. Do your best not to rely on palpation technique. As you've learned, you can't feel the pressure accurately. Also, we'd like you to make manometer use a standard part of your practice. We currently have 3 manometers available in the anesthesia workroom, and we plan to purchase more. In summary, the endotracheal tube cuffs should always be kept between 20 and 30 centimeters of water using a manometer. This simple technique prevents serious complication and ensures your patient is safely and effectively ventilated.
If you have any questions, please feel free to email us or ask us in person. We thank you for your time. And these are our references. Thank you again.